I want to talk about the location of a diastasis recti and what it means about how we're going to guide treatment, basically. So what do we need to do in terms of figuring out what muscles need to work harder, what your posture needs to do, those type of things. So you're going to figure out doing the self-test where your diastasis is. Is it at the belly button? Is it above, or is it below? If you have one above, typically those people, I see a little bit more of a rib flare. So their ribs are going to flare out like this, and you'll see them posture a little bit more in this way. And I'm exaggerating for the sake of demonstration, but they're a little bit more like this, kind of this like chest up presentation. And that is causing this gap or this pressure in this general area. So what we want to do is we want to redirect and get them to bring that chest a little bit down by breathing more into their back so that we can create more, not compression, but more tightness in this area to help close that gap, okay? Now, if you have it below the belly button, typically what I'm seeing in those people is a combination of maybe some weakness in the lower abdominals of the internal obliques and the transverse abdominis. But also what I'm seeing is those people tend to posture a little bit more like this. Sort of that like, and I'm exaggerating again, but a little bit of that like baby carrying, like hips forward, type of kind of flat butt, that kind of posture. And you can see how when I'm there, that's gonna push my belly forward here and create this pressure or gapping forward, okay? If you have it in the belly button, that tells me that you need a little bit more of those middle transverse abdominal muscles working. Okay, and that's the most common spot, especially in women who have had babies, because that's the most common place for the baby to kind of stick out. That being said, there are women who carry higher, and you might see them with a diastasis that is a little bit higher, and there's women that carry lower, and you might see them with that diastasis a little bit lower. So just use those tips to help you sort of direct where your treatment is going to go.